Hello there, this is Team Diaton Tonometer with the SECO International here in Atlanta. There's a couple important topics we wanted to cover here with you today. We're with the Diaton, and the Diaton allows you to measure pressure through the upper eyelid and sclera. Why is it important? Number of reasons. Nowadays, we have, unfortunately, the topic of infection control. So, tonometry and infection control. What is the solution? The solution is IOP through the eyelid. There is no direct contact with the cornea, no contact with mucous membrane at all. Okay. Another major advantage here is we're thinking outside of the cornea. So corneal parameters do not affect the reading, but moreover, the reading is done through the eyelid, not directly through the cornea. And we're actually going to demonstrate and show you the most protected way. And unfortunately nowadays, we need to be concerned about these things a little bit more, from coronas to other diseases. So, Andrea, would you mind?
Yes.
You're fantastic. Thank you so much. So, before you work with the patient, so some of the things we're trying to minimize, for one, the contact. In optometry, ophthalmologists might be a little bit on the extreme side, but nowadays I am going to put the glove because there will be some contact with the patient, so we minimize that contact completely. I don't normally put gloves, so this is just for demo purposes. Okay, now we have the tool with the device. Okay, the device was already cleaned, with whatever solution that's appropriate within the organization, the actual body of the device. But the tip of the device, which comes in contact with the patient, will be cleaned with an alcohol swab, which is an adequate method. So now with the patient, I would ask the patient to sit a little bit closer to the edge of the chair, tilt the head back, and ask the patient to extend their thumb forward. Come a little closer. So this is the finger that would gently come in contact with the patient's eye. So I would ask the patient to look at the finger, gently pull on the lid. Use the edge of my palm for support. Yet again, I'm wearing a glove. I'm not touching the patient. And we're going over the eyelid. If you don't mind zooming in a little bit, you will see 1 and 2. So we're taking the reading. We got the average of the reading. Second eye, you're still on the same side of the patient. Turn it off. Here I use the thumb. We're not touching the eyeball. 1 and 2. We get the average of the readings. Okay. Thank you so much. This was a quick demonstration and introduction of how to safely measure intraocular pressure completely independent of the corneal properties, and minimize the infection control spread from a patient to patient, from a user within your practice. With that said, this was Team Diaton Tonometer. We're at SECO. Looking forward to address your questions and minimize the effect of the lid. Come over for a second. Yet again, just wanted to point out the positioning of the lid. Okay. We want to make our day-to-day a little safer. We want to go to movie theaters, to the malls, and not worry and think about it. So we as an industry want to help you to achieve that. Thanks again, Team Diaton. If you have any questions, so visit us at diaton.com. Take care.